The normal body temperature depends on the balance between heat production and heat loss. The body heat is produced mainly by metabolism of the food, that is called as basal metabolism, food assimilation, muscular activity, and the accumulation of the brown fat or burning of the brown fat. Whereas body loses its heat by radiation, conduction, vaporization of the sweat, and the small amount of heat is lost also through urine and feces. Group of reflex responses that are primarily integrated in hypothalamus uh, operated to maintain body temperature in a narrow range in spite of a wide fluctuation in the environmental temperature in warm-blooded, that is homeothermic animals constitute the mechanism of temperature regulation. The regulation of the body temperature is important because the speed of chemical reaction taking place in the body depends mainly on the body temperature. The enzymes of the body show optimum activity within a narrow range of temperature. The measurement of temperature mainly done in degrees Celsius and Fahrenheit. The normal oral temperature is 36.3 to 37.1% centigrade or around 98.6 degree Fahrenheit. The scrotal temperature is 32 degrees Celsius, which is a little less than the normal body temperature, which is useful to facilitate the spermatogenesis in males. Oral temperature is 0.5 degrees Celsius less than the rectal temperature. Oral temperature is variable, but the rectal, that is core temperature, is constant. Hyperthermia is when temperature increases more than 41.6 degrees Celsius, and hypothermia is when temperature decreases less than 25 degrees Celsius. There will be some physiological variations. Temperature normally increases in the morning and decreases in the evening. In females, during ovulation, body temperature increases. During exercise, body temperature increases to 40 degrees Celsius. The causes are inability of heat dissipating mechanism to handle increased amount of heat production and elevation of the body temperature, that is a set point of hypothalamus at which heat dissipating mechanisms are activated are the cause for increase in the body temperature. Some adults have chronically above normal temperature known as constitutional hyperthermia. Temperature regulation is less precise in young children. They may normally have a temperature that is 0.5 degrees Celsius or so above the established norm for adults. In females, the body temperature is normally 0.5 degree Celsius more than in males, especially during ovulation and after ovulation till menstruation, and during luteal and progesterone phase. There can also be pathological variation where in hypothyroidism the temperature increases 0.5 degree Celsius more than the normal. Coming to the central regulation of the temperature, hypothalamus is considered a thermostat. Temperature is set at normal level in hypothalamus, and when body temperature increases or falls from set point level, various mechanisms get activated to bring back the temperature to set point level. Anterior hypothalamus is activated by warmth and is considered to be heat loss center, whereas posterior hypothalamus is activated by cold and is known as heat gain center. Various mechanisms of temperature regulation. Afferent impulses, which brings the information reach about the temperature, they reach the hypothalamus from the receptors, that is skin, deep tissue, spinal cord, extra hypothalamic region of the brain and other parts of the brain, and activate the following mechanisms. The mechanisms that are activated by cold, they increase the heat production by shivering, increasing the hunger, increasing the voluntary activity, and increasing the production of epinephrine and norepinephrine. Shivering is an involuntary response of a skeletal muscle to cold, which increases the skeletal muscle contraction, which in turn increases heat production. Increased hunger causes increase in the food intake, increases the utilization of the food, and increases the body temperature. Whereas increased voluntary activity leads to increase in the body temperature because of the production of the heat in the muscles, and increased production They also decrease the heat loss by vasoconstriction, horripilation, or concurrent blood flow which is occurring in the extremities, and behavioral changes. They tend to decrease the heat loss. Vasoconstriction, uh, if occurs, the amount of heat reaching the skin from the deeper tissues is decreased and will store heat centrally in the blood vessels. Cutaneous vessels, being cool, is more sensitive to catecholamines and leads to further constriction of arterioles and venules. Horripilation, the goose wildness, uh, the cold indented contraction of the erector muscles occurs here, and it is important in case of animals. Here there will be increased tapping of the hair, which causes increased heat production. Then in animals, at extremities, arteries and veins are arranged parallel. Deep veins run along the side arteries supplying limbs. Heat transfer uh, heat transfer from between the warm arterial blood going to the limbs and cold venous blood coming from extremities cause countercurrent exchange of heat, causing conservation of the heat. Behavioral changes like curling up also, they tend to conserve heat. The mechanisms that are activated by heat, where they're going to increase the heat loss. The heat loss is mainly by conduction, convection, and radiation. When surrounding temperature is much lower, heat loss takes place mainly through the conduction, convection, and radiation. When surrounding temperature is close to body temperature, evaporation becomes a major route of heat loss. Sweating. When body temperature increases, there is increased sweating, thus increased vaporization of water from the body surface, which in turn decreases the body temperature. Vaporization also occurs through mucous membrane of oral cavity and respiratory uh, passages. Thus there is a certain amount of water loss continuously, called insensible loss of water. Vaporization of 1 gram of water removes 0.6 kilocalories of heat. Cutaneous vasodilatation. Conduction occurs from surface of one object to surface of another object. Temperature of the skin determines to a great extent the degree to which the heat is gained or lost. The amount of heat reaching the skin from the deeper tissues can be varied by changing the blood flow to the skin. When temperature increases, cutaneous vessels are dilated, warm blood reaches the skin and is lost to the surroundings. The rate at which heat is transferred from deep tissues to the skin is called as tissue conductance, and it increases at high temperature. Panting is a rapid and shallow breathing which is seen in animals to lose heat from the salivation. It leads also decrease in the heat production, that is it leads to generalized lethargy and apathy, which causes decreased muscular activity, and thus heat production is reduced. It also leads to loss of appetite, which causes decreased food intake and thus decreased heat production. So this is a diagrammatic representation of uh, the regulation of the body temperature. It is mainly regulated by the hypothalamus, the anterior hypothalamus and posterior hypothalamus. Anterior hypothalamus is preoptic center, where it is going to receive information from the peripheral neural structures and blood temperature and pyrogens. And when the temperature increases, it is going to lead to the heat loss by sweating and vasodilatation. When temperature decreases, so there will be increase in the heat production uh, by mechanisms of shivering and vasoconstriction. And the thermoset point is in the hypothalamus, uh, which is going to take a comfort decision if there is a cold uh, I mean the body is going to increase temperature mainly by the vasoconstriction, the utilization of the brown adipose tissues, and shivering of the somatic muscles, which ultimately going to increase the temperature. And whenever the body temperature increases, mainly the sweat glands, through the sweat glands, by the vasodilatation, the body heat is